Kia ora, my name's Margie Olds, and this is the Glenohumeral Gurus podcast. This is a podcast for clinicians interested in shoulder rehabilitation. I'm a shoulder therapist based in Auckland, New Zealand, and in this podcast, I interview clinicians and researchers across the globe about their research and their clinical practice on how we can improve outcomes for people with shoulder pathologies. The aim is to learn, laugh, and try to work out how we can help people with shoulder problems. Enjoy the podcast. This episode is brought to you by Flawless Motion, shoulder braces that are designed for people with shoulder instability in male, female, and bilateral versions. So check out flawlessmotion.com for your shoulder brace requirements. We've also just expanded now to the UK, so if you live in the UK or Europe, you can get your shoulder braces much more quickly. So check us out at flawlessmotion.co.uk and you can check out our shoulder braces there. Cheers. Welcome back, Wieger Heijink, to today's podcast, where it's a continuation on from what we've learned from you, part three, as it turns out. We thought it was going to be a two-part session, but now part three, and you assure me your son is well, and we're ready to
Yeah,
continue.
yeah. Thank you very much for having me again. It was a little bit a rough end last time, but my son is all right, so we can continue now.
Thank you. So I was midway asking you around fear and how fear changes the motor program. And I had read around people in fear will become novice learners. And so I treat them as a novice learner and progress them through their rehab in that way. And I think that explains really why they have the hesitancy after and how fear changes movement patterns. What are your thoughts around that? What do you see in patients?
I think when we look at the constraint-led approach, it's a really nice part of the dynamic systems approach. You can see fear as a constraint, and for some people, fear they don't it doesn't constrain them at all. They don't have
Mhm.
any problems with it. But with other patients, it can be a very big constraint in how they move. And I think when you look at it that way, you see that there are expert learners, expert movers, but they are constrained by the fear they have gotten by injury and everything. And then you can see it in an all different way of training. Then you can try to get rid of this constraint by adding other exercises, trying to do it that way. There's a really nice picture. Well, I can't picture it on a podcast, but when you have a diagram and you have skill on one side and you have difficulty on the other side, you want to have them right in the middle, straight up, and then you have the good flow. When you're moving way too easy, you get boredom, and
Yes,
when you're way too difficult, then you get anxiety.
yes,
And you want
okay.
to have them in the flow, but people with fear, they will have anxiety very, very soon. So you have to pull back your difficulty a little bit, make
Yes.
it much more easier. And when they experience, hey, they're getting in the flow, then you probably can move up your difficulty very fast and get them there. But
Mm.
but yeah, that's the way I see it.
And so the difference is just let me dig into that so that I understand to see if it would change my practice. Where I have been treating people as novice learners who have fear, you would explain them as an expert learner who is constraint-led. Can you
Constrained by the fear. Yeah.
yeah, can you explain that to me? Constrained by the fear.
Yes, like when you have an athlete with shoulder pain and he's afraid of, for example, a volleyball player afraid of hitting hard because it always aches him so much, and
Yes.
he's getting fair. I saw this patient last Friday, and he's doing very well, but this unexpected movements, it's really freaking him out every time. But he's a very skilled sportsman. He's a high level sportsman, but the fear is constraining him. So
Mm.
now I'm treating him as a very trained sportsman, doing all these really great exercises he really loves, getting him tired, getting him into difficult positions. But I'm taking care of his shoulder by constraining his shoulder movement. So putting his hand in his pocket, doing all this crazy movement. So his arm is restricted, won't hurt him, and
Yeah.
still he can do very difficult things. And that's I think a great way of training somebody, making sure he has no pain, but still treating them on the level they deserve, they want,
And so,
they
how do you
like.
explain? Because I would argue, well, you're not establishing enough capacity in the tissue. You're not loading his arm enough. He is delayed in the muscle onset, and he doesn't have sufficient speed of activity. That's how I would have explained that problem. How would you?
Yeah, well,
At what point you will eventually layer up his shoulder into that?
yeah, of course, but in the end, first, like we discussed already, yeah, moving successfully is moving around all these joints,
Mm,
and shoulder joint is the one is hurting him. So when I'm protecting his shoulder joint and move around all the other joints, his shoulder is getting the co-contractions there, is and then that's what you need to protect it, but in a very safe position. So perhaps I don't load him in the end position, but the rest of his body is.
yes,
So
but
yeah.
eventually you will load him in
I
the end.
think, yeah, yeah, of course, you have to go there.
Well,
You have to
I
go
didn't
there.
know, so I was
Yeah.
just checking. We
But but
were,
but I'll do it in the end when the tissue has healed, when he's no pain anymore, then we're gonna load the tissue. But
yes,
in this
okay.
phase when the tissue hasn't healed yet, when there's still pain and everything, yeah, we can do so much things. And I think
Mm,
a lot of physiotherapists are missing that part. It's
yes. But
really a
lots
pity
of
because
these
you miss so
patients,
many time,
yeah,
so
they
much
are
time.
chronic patients, eh? So there's
Yeah.
no, their tissue, it's not that their tissue hasn't healed. How do you argue that from a tissue perspective?
Yeah, I think that when they still have pain, you have to protect them. And I'm not, I can see with the ultrasound how it's look like, but I'm not gonna think every time, oh, is the tissue all right or everything? You have a pretty good idea of it, and then we're gonna just treat it like a system. And I'm not gonna think about, hey, is this tendon doing that
Yeah.
or not? I'm just treating
Okay.
it, hey, when the muscle synergies aren't working, either you have to find new synergies, find another way of training, or you have to make sure that that synergy is getting better at what it's doing. And
Okay.
then the load on the tissue will come eventually. And when
Yeah.
everything is working fine, there's no strain on the tissue anymore because all the other joints are working so good. The strain is really limited.
Okay.
You
I
get
understand.
problems in your tissue when you have really this um, just moving around one joint and doing
Mm.
it repetitively. Yeah, all this repetition doing the same thing every time, then you get a lot of load, then you get injuries. And when you
Yeah.
make
Okay.
different movements all the time, Bernstein called it repetition without repetition. So you move every time a little bit different, then you get no overuse.
Yes.
Overuse is much
Okay.
less.
Yes, which is applicable to your overhead volleyball player. I
Yeah.
have a patient that that comes to mind as soon as you say that I have a pro and she's doing well. I guess it's interesting to see the perspectives. It would just be interesting to see if I could have got her better quicker with a different
Yeah,
approach.
that's the big
That's
point.
what
We're
I'm
all making
interested in.
success, but perhaps can we do it quicker? Can we
Yeah.
speed the progress?
Yeah. And
The
for some
yeah,
people, I think what I like about your approach is could because some people will be non-responders for my approach. Like some people, I imagine you don't have a hundred
yeah.
percent success rate. So is
Nobody has. Nobody has, I
exactly,
think.
exactly.
Yeah,
And so is there a
yeah,
different way? And for me,
yeah,
I'm thinking, oh yeah, well maybe if they don't like it this way, maybe now I have another way to approach that. So that's really
yeah.
nice. I read online somewhere around the three Ps. This is a way for you to progress your rehabilitation. What can you tell me?
Yeah, it's a way of training co-contractions, and when you want to protect yourself, you need co-contractions. It's like playing rugby, yeah. When you have to move very fast, but when there's the impact, when there's somebody coming with the tackle, you really have to you have to brace yourself, and you
Yes,
brace yourself with putting
yes,
everything together, the co-contractions.
But
So
I would argue, sorry to interrupt, but because co-contractions puzzle me a little bit, and I see at a base level that it might be useful for shoulder stability, but having an impact, that's very directional. I don't need co-contraction both sides of the joint. My impact is one side, therefore I need to brace on that
yeah,
side. Sorry to dig into,
yeah,
but this is what I wanted to know.
yeah, but you have, I think when you look at it a different way, it's moving is all about energy. It's all about getting energy from one point to the other point. Like the volleyball player, he
Yes.
has to put impact from his hand into the ball. Yeah,
Okay.
and you have to when you change the
Oh,
energy
okay.
to the ball, you have to
Yes.
protect yourself, but
Yes.
also when you change directions of energy. So you wind up and you go back. At that point, you change the directions of your movement. You have to have
Yes.
co-contractions
So you don't talk
that they're
about,
doing.
when you use the word co-contraction, you're not talking about rotator cuff muscles on coming on at the same
Yeah,
time. You're
yeah,
talking
still,
about
still. No,
you
no, no.
you
Also,
are,
when
because
you
that's
change
where I would
direction
probably
at
yes,
one point you're going from the external rotation to internal rotation. You have to change directions. At
yes,
that point, you're at risk. It's an
yes,
apprehension test. You're at risk, so you have to have a very quick moment of a co-contraction. But there's this trade-off between being very flexible and having
yes,
co-contractions. When you only have co-contractions, you become very rigid.
yes. Because I
And
would
when
argue
you,
you are quickly moving from, say, anterior cuff to posterior cuff.
yeah,
That isn't
yeah,
really about your cuff being on, like people
yeah, but I
traditionally.
think that the idea from anterior cuff to posterior cuff, I think the idea doesn't fit. I think it's you have this energy in your kinetic chain, moving up, your arm going backwards, and then you have get this change of direction, really elastic. But at that moment,
Yes,
your cuff is not there to make the speed; it's
yes,
there to protect your shoulder.
yes,
Because the speed is in all the tissue winding up, giving the elastic movement into your arm. This how do you call it? This whip you're
yes.
playing with. A whip doesn't have any muscles in it, but still getting the energy from one
Yeah,
side to the other
okay.
side. So it's a whip movement, and in that movement you need protection. When you have a whip that's very flexible, it doesn't work. It has to
Mm,
be both flexible and a little bit rigid. And this
yes, to have that
rigidness is in
elasticity.
co-contractions at the right moment. So
Yeah,
there's this trade-off between flexible, getting to move up, and then when you change directions, you have to protect your cuff and you have them all together. It's not one muscle doing it. It's really co-contractions at that moment, but the timing, the better you time it, the shorter you can need your co-contractions, the better
mm,
movement you become, the better mover you become. So
yeah, and
really,
that's around that learning, isn't it? And the skillful change between,
yeah, it's like
anterior versus posterior,
I,
I
I
guess.
just watched before we came. I just watched the ice hockey finale,
Okay.
final. It's
Yes,
and there you see it very well. They're so agile, and then come this other player with this body check. Yeah, then
yes,
you have to pace yourself. You do it with co-contractions, and you go on again.
yeah,
So I
okay.
don't think you have to use one muscle. The best way to protect yourself is just putting it all together. It's really easy for your body
To
to
brace like
organize.
that.
Flow contractions are very easy to organize, so your brain doesn't have to go to one muscle and everything. It's just
Yeah, right.
put them all together and release.
Yes,
Putting together,
yes,
release. Yeah.
right.
And these co-contractions, you can train them with, we call it the three P's, the
Yes, back to,
reflexes.
tell me about that.
Yeah, so we use a lot of perturbations, for example, with the tidal tank, the aqua bag,
Yes,
shaking it, everything. Then you have the flexibility and you have the co-contractions. Otherwise, the water will go all the way and you're lost. So perturbations is a very important one.
yes,
And you have to put up time pressure because when you don't have much time to move, you will need co-contractions in your self-organization because it's a very easy, very fast way to organize in your body.
yes, yes,
Yeah. And preflexes, it's like the start from the 100-meter sprint. They're not totally relaxed there. They use co-contractions to be steady and get going. So that are the three P's I use in my rehabilitation. to get this system of very efficient, very fast, very well organized protection of your shoulder.
Okay,
And I
can we
think
just dig back into that co-contraction so I understand? You're not necessarily talking about it just as it relates to rotator cuff. You're talking
no,
about
no, no, no.
using it
I'm
for lots of different muscles. I guess
lots of different
traditionally,
muscles. Yeah,
yeah,
and
right.
I'm not even thinking what muscles you're using. I don't care.
Okay,
I don't
okay.
care. You just have to protect it, and you
Yes.
protect it with co-contractions always.
And
It's in the knee,
co-contraction
in
is
the foot.
about almost bracing or lots of different muscles of
Yeah,
whatever they are coming on to hold on to
yeah.
the
To
to
hold
what
them
it's
to
for.
that position, and it always has to do with energy change of energy,
Right,
changes
okay.
directions, or just throwing everything or getting contact. It's
Yes,
like a water polo handball player who's throwing a ball, getting blocked. There's a
yes,
lot of energy there, and you have to be able to protect it at that moment. And the
yes.
fastest way to do that is to get co-contractions.
I
That's how
understand.
the body
I
moves.
understand. Yes, we were thinking of the word in different ways. Talk me
Yeah,
through
yeah. So
then.
that's good to,
Yeah, it's
yeah.
good to drill into that so that I truly understand the difference. Why you would choose perturbation over preflex versus time pressure. Why would you choose one versus the other? Do, or,
I used them all. I used them all, and in different if you want to be very efficient in movement, you have to be in all these different
yes,
positions, different exercises, different challenges. So
yes.
one time I used time pressure, then more perturbations, then we're going to use preflexes, and then perturbations, change it all
And you
around.
just mix them all up
Mix it
within
up,
the
mix it
same
up.
session.
Yeah.
Do you have any advice for clinicians who are trying to use this approach? What they should, how do you've obviously been using this approach for a number of years and are very
Yeah.
skillful at it, but a new clinician trying to use this approach, how might they use one versus the other? Or you don't think it matters? They could just experiment and see.
Yeah, I would say try to go experience it with it.
Yeah.
Perturbations always work very well with the aqua bags,
The aquabag, yeah.
shaking it, bringing it from
Hmm.
one position then back, and then when you go faster and faster, you also have the time pressure there, so you can mix it up all
Okay,
the
you
time.
can dial
Yeah.
it up.
Yeah, you can dial it up, and it's well, it's like in sports, eh? You have to do it very often and very consistent to become skillful, and that's with
Yes,
rehab too. This approach is
yes,
very new, so also when we give courses in it, yeah, many physiotherapists have never heard of it, so it's all new. Well, they don't learn it in one day from me. They have to go work with it and work with it,
yes, and
make
try it.
failures, and what
Yeah,
I always should say to my sportsmen when they're getting into this approach, in the beginning, your performance goes down. When you're
yes,
doing new things, your performance goes down. And it's also for us in our profession. When you when you're going in with your patients doing new stuff, your performance goes down. Your patients will not all be happy in the beginning. You have to take that into account. Yeah,
do you
and that's
have any
hard for us.
advice then for physios trying to learn this to limit the time that their performance is down? Because obviously physios are then new learners and learning
They are
versus
the new
learning.
learners.
Sure, but
Well,
how do
we
they
have a
make that
lot of
short?
exercises on our YouTube channel, Shoulder
Yes,
Science.
yes,
They get
okay.
inspiration there, but it's not a it you still have to go experience how it works. But you can find so much exercise. You don't have to find them out all for yourself. It's all been done. It's all
Yes,
there.
okay. So if I put the link to the YouTube channel, then that will help. And maybe
I
clinicians
hope
could
it will
practice.
help. Yeah.
Yeah, I hope it will help
Yeah.
too. Maybe they could practice then themselves before they then use them for patients, might give them a better understanding.
Yeah, and if there are questions, contact me on LinkedIn or something, and
Yes, okay.
yeah,
Okay,
yeah,
thank
and
you.
always help them, of course.
Yes, yes. And so you're so generous with your time. Is there anything else so we could wrap this up now. Is there anything
Yeah,
else you want clinicians to understand or you think is really important for them when they are trialing or thinking about this type of rehabilitation?
Yeah, well, I think it's nice to dig into something very new. This
Yes.
way of moving, the dynamic system. It's so fascinating to get to know it. It really changed my way of working. I can never get back. I will never work with internal focus again. I can't do it anymore. It's so much more fun and so much more. Yeah, I think my patients are getting so much faster into recovery,
Yeah.
getting better so much faster with what we're doing now. So yeah, I can't change it anymore. And when you dive into it, into ecological psychology, there's so much there. It still
Mm.
blows my mind what's all around there. I'm still
Yeah,
learning
so
all the time.
fascinating, and
So
it's sparked
yeah,
my interest again in diving deep into that
yeah,
to have a look. So thank you very much for your time. I just
yeah. You're welcome.
in closing, I think I had seen a video of you on a unicycle. This is a true story.
Yeah. Yeah, what one thing when I started with all these dynamic systems and everything, I thought to myself, I have to learn new things. I'm
Yeah.
want to know things about learning, motor learning, so I have to force myself to do new things. So I went bouldering, I'm doing Brazilian Jiu-Jitsu, I do everything with my left hand now. I'm cutting everything with left, I'm shaving with my left hand. So
So
I'm
that
not
you can learn
right-handed
something
anymore.
new.
Yeah, I
You,
do everything playing padel with my left hand instead of with my right hand. So, and that's also, we got a patient with, she told us that she had a unicycle, and we said, oh, well, bring it here, let's show it. Next time, she said, I have it here. And we tried it, and it was terrible. No way I could make one trip
Fun
with it.
revolution.
Yeah, so we immediately bought one ourselves with our team. And now it's been winter, so we haven't done it for 2, 3 months now. It's too cold
Okay.
outside. But
Yes.
this week it will be better weather, so we go
Maybe.
unicycling again. And we tried it on the treadmill, but that's a challenge.
Yes, I think that is the clip that I saw was on the
Yeah.
video. It looked very challenging. I think
I
what I
nearly
really
wasn't there anymore.
yeah. I really admire the it is essential that we remain new learners at something, isn't it?
Yeah,
I
yeah,
think
yeah, yeah.
for yeah,
And
so wonderful.
when we have done this one, we'll find something new,
Yeah.
another
There's so
challenging.
many things to learn.
Yeah, so we're also slacklining and all these things that are new. We really like to explore it ourselves.
Yes.
Yeah,
Yes.
and
And so I will post up the videos that of the YouTube link for
yeah,
patients to or physios to see then
yeah,
so
how
that
we're
they could
working and
access that and then they can try learning something new as well.
yeah, we've got this playlist with explanation of things, playlist with how to start with
Yeah,
exercise. You
okay.
don't need anything with the Swiss ball. They
Yeah.
will find it out, I think.
Okay, so if people
Yeah,
just check the show notes, then they
yeah.
can have a look. Vika, thank you very much for your time. Lovely to connect with you again.
Yeah, thank you very much for having me. I was really pleased and really happy with it.
Yeah,
Thank you.
thank you. And thanks again to Flawless Motion for supporting this episode. So, if you want to know more about the shoulder braces or other clinician resources, then head to flawlessmotion.com or flawlessmotion.co.uk for more information. Thanks for listening. I hope you enjoyed the podcast and found some clinically useful tips for your patients in clinic. Please subscribe to the podcast and follow me on social media to keep across the latest releases of the podcast. Don't forget, if you need a shoulder brace for your patients, then check out our shoulder braces at flawlessmotion.com. And if you want to know more about assessment and treatment of rehabilitation of your patients, then check out the online shoulder courses at margieolds.com. Otherwise, take care, enjoy, and see you next time. Please remember that this podcast is for educational purposes for clinicians only and does not constitute medical advice. Please consult with a qualified health professional or contact me to book an appointment for individual assessment and treatment. Cheers.